Hello, everyone. Welcome to our first June Wellness session. It's Pride Month this month, and we hope that you can share with us your stories, photos on how you celebrate the history, resilience, and uniqueness of the LGBTQ plus community. Due June 15th. And our session today is Fostering Trust with LGBTQI and Nurturing the Body and Heart with Elizabeth Gonzalez Morales, MA LMFT. We hope to learn the background history of the barriers that this population encounters when accessing different care systems and learn helpful ways to foster trust as a care system and individual ways to foster trust and help people feel welcome. Elizabeth Gonzalez Morales is a queer, spiritual, non-binary, bilingual, and bicultural person, and she is an LMFT with specialization in Latinx family studies from the Pacific Oaks College. We hope that you'll complete the session evaluation at the end of the session. And a quick disclaimer, the Wellness Tips website, sessions and recorded videos that we provide are for informational and educational purposes only. They are not meant to be considered or used for medical diagnosis or treatment. If you have any medical concerns, please contact your healthcare provider. Thank you so much, and take it away, Elizabeth.
Hi there, welcome everyone. Thank you for allowing me to join you today. I'm going to share my screen. All right. So, right, happy Pride Month and happy Pride Year to everyone, to so many folks. So today I'm going to share with you some information about how do we build trust and continue to make a safe space for everyone that we may walk with. First of all, I want to acknowledge in your side, Contra Costa, I want to acknowledge the land of the Yokuts, the Cart King, the Confederate villages of Lishan, the Olowe, the Miwok, the Muweka people, the Tongva people, the Tatavian people, Serrano, Kis, and Chumash people. We want to acknowledge and be grateful to be here in this land. So as Arlene shared, right, my parents are Sara Morales Vidal y Jose Gonzalez, Jose Manuel Gonzalez Garcia. We come from the Chichimeca land in, what we know of Mexico, Guanajuato, the Guamares people, those were some of our ancestors. I also had the chance to live in the Maya land. So, what we know of Campeche, Tabasco over there. So there's a lot of influence within me as well. As Sterling mentioned, I identify as a queer person, non-binary, bilingual, bicultural. I graduated from Pacific Oaks College. And now I have my own private practice, as well as I teach part-time at Pacific Oaks College and Pepperdine University. Something that I didn't add, I am in the process of writing a paper for the American Psychological Association in partnership with a few other folks. So yeah, there's so much that we want to do. There's some other projects in the works to further accessibility for Black and Brown folks, LGBTQIA plus folks. So that's in the works. Stay tuned. So before we start, I want us to just take a little pause and enjoy this video I took when, I went to a trip last year in Campeche. And I would like for us to, feel comfortable in wherever you are. You can focus at any part of this video. You can stay with the sound. You can stay with the visuals. So whatever your body calls to, stay with it and just, this is all we have in this moment. Okay. All right. I wanted to share something that I've personally, have experienced and that it can, there's more of a connection. So let's go on. So I think, first of all, when we start to speak of LGBTQIA plus folks, queer folks, trans folks, gender expansive folks, right? We really want to make sure that we understand sort of at the root, at the core of what has happened for us, right? Heteronormativity is this belief system that we have taken in for many, many, many years, right? And the system says to us that there's only two sexes, right? There's boy or girl, that boy and girl are to do specific things. They're to dress very specifically, that, right, folks are just to procreate, and that's sort of the ultimate goal, and procreation requires a male and female, and that's sort of the purpose for folks. So very, very much sort of Darwin's theory, right, of survivalism. And so with that comes not just personality traits, ways of relating with one another, gender roles. So think of, right, in so many places, we see this. We see this in music. We see this in old texts. We see this in movies. We see this at home. We see this at school, everywhere, right? We're still seeing this with these gender reveals. So we're still categorizing folks in a very binary way, just, right, boy or girl, blue, pink, right, aggression or strength versus nurturing. So as we go on the conversation, remember, this is sort of the belief system that all of us, most of us, grow up with and continue to sort of feed this, okay? Me as a clinician, right, working in mental health, not too long ago, homosexuality was a personality disturbance. It was seen as a mental disorder. It was seen as something where it's not normal, right? And the DSM is sort of our Bible in a way that says when these things are happening for people, they're not okay, right? So, it was still very much as something that was not okay, something that was abnormal. Okay, so you see how the influence of heteronormativity shows up here as well. We see this all the time. We're still seeing it, and we saw an increase in such bills in 2020, and so there's all these bills, right, that our government, that our neighboring states are passing. For instance, in 2023, right, there's been already 287 bills that have been introduced in regards to limiting, restricting people's rights, whether, participating in sports, whether it be how they look or the type of restroom that they need to use. And out of all those 287, 39 have been passed already. So there's a lot in the air, right? There's a lot in the air. I know we live in California, and even here, remember, right? If you don't fit within this heteronormative perspective, right? If you're not boy or girl, or don't fit in between these very two rigid boxes, then, right, so many places are telling you you're not okay, or you don't really belong. Some of these bills, right? The meaning of biological sex for such construction. What does that mean? That, right, we have to define what a female is, we have to define what a male is, and with those definitions, then we are to make our laws. Other, as I mentioned, our bills focus on, separation. Well, girls play here, women play over there, boys or men play this way. There's no sharing of space. So there's a lot that is happening around us that continues to reinforce this heteronormative view of life, of people, and how we are to live. As you know, these there's a lot of difficulties, right, that people experience, and a lot of people, especially young people who are coming into their own, who are learning who they are experiencing this shutdown, this rejection, this alienation from the environment, from society. And so I want to make it very clear that LGBTQIA plus people do not experience anxiety or wanting to die, or an actual suicide attempt, or depression, or substance use, or homeless because of being LGBTQIA plus people. They experience, or we experience, all of this because society continues to say it is not okay who you are. It's a sin. It is not okay. You are going to be rejected, right? You don't fit these molds that we have used for hundreds of years, right? And so when you're a person and you say to yourself, or you feel that, well, I don't really believe, like, I'm a woman, or for instance, I can share about myself, right? As I was growing up, the idea was, yeah, okay, I'm a woman, I'm supposed to marry a man, I'm supposed to have kids, and that's what my life is supposed to be. None of that felt like I wanted to do, right? But we very early on, we take on those messages about who we are supposed to be. And so when you feel strongly about you don't want to do that, then what is the option, right? So people tend to feel alone, right? Tend to feel rejected, alienated. And all of that is what causes the anxiety, the depression, the substance use, the suicidal ideation, the homelessness, because people get kicked out, people are not supported. So I really want us to have that in mind, that because of the bias, because of the discrimination and the prejudice, that's where people develop these difficulties, mental and social. So here we have the genderbread person. And this is really, really great activity for us to start to, see beyond, right, the binary, see beyond the gender, the heteronormativity. And what we have here, right, as a person, we have different layers of individual identity, right? For instance, our sex. those are sex characteristics, right? That's your biological sex, your genitalia, what you have. And we know that there's folks who have male genitalia or a male body, a female physiology, or there's intersex folks. We have attraction, right? Our heart and who we love. And so that's also, there's a spectrum, right, to our attraction. We have sexual attraction, romantic attraction, our identity. That's the idea of how we see ourselves, right? How we experience gender, how we define our gender, whether we align with it or not. And then there's our gender expression, right? Yes, as you can see, right, my gender expression is having short hair, wearing, this kind of shirt, and maybe wearing some jewelry. So what we look on the outside, right, is not the same as our attraction. It may not be the same as our identity. So it's important for us to see this as a spectrum, and that folks get to decide, right, what level of womanness, of masculinity or femininity feels right for them. So, and I think here's where we come in as people, as humans, right? And a lot of the times, even working as a clinician, right? As you can see, right, as you can tell from seeing me, I am outside the binary, right? I am not. There's some sort of air of right, what kind of person I am, right? And working with LGBTQIA plus folks, especially the young folks, seeing somebody that it's not very clear, like woman or man, and the looks, right, the gender expression, it brings so much out, without speaking for them. It creates sort of this safe place to meet with me. And so a lot of the times folks have negative experiences with providers, again, because everything in the world, in society, says you're not okay, you shouldn't be here, it's not okay who you are. Folks tend to look for very small clues to possibility, to expansion. So, right, it can be somebody that looks, that doesn't fit the binary, that doesn't fit, look very women or very men, somebody that maybe have a pride flag. We look for those little things that can give us a little opening of maybe it is okay, or maybe this person, won't judge me or see me as abnormal. So using gender neutral language is something that we can all use, right? We can start from start to shed away from woman and men and become more gender neutral: person, siblings, partner, spouse, what else? Doctor, actor, student, folks, people. And so when you do that, when we do that, right, we begin to make the space for people that don't fit within woman, man, sister, mother, father. So that's something that we can all use. When folks come into getting services, a lot of the times, right, somebody may be using another name, a chosen name or preferred name. And it's important for us to, if that were to happen, if somebody's insurance card or ID says a name and the person tells you a different name, then we'd say, okay, what name do you prefer to use? Or, okay, what name is your chart on? So I will share with you the standards of care. It's, for folks to broaden their knowledge and how we can support gender expansive trans folks. And so, another thing that we really want to look at, how do we, when we come in and meet people, who are their chosen family, who are people that they can go to, again, because, right, folks get alienated and excluded in so many other places. When we can come in and ask folks, who can you trust, who's your chosen family, or what kind of services do you need? Do you need more support, or we can provide sort of referrals in a way, understanding that, right, people have difficulty accessing certain services, and so knowing what places from the get-go are very affirming is very helpful for folks, because you give them a sense of I can understand, right, the difficulties, and I can sort of share with you where you can go to get help and to be seen and heard. Right, and there's crisis numbers that are available for folks too, in case, right, there's a lot of safety concerns. So those are some of the ways that we can show up for folks. Right, practice when you meet somebody, or you also can start this and say, hey, my name is Elizabeth, my pronouns are they and them. What are your pronouns? Or how do you want to go by? What is your name? So being mindful of the language that we use. It's something that we can practice anytime that we meet people. So with that, I wanna close it with Alok, their person who are poet. They write, and I think this statement makes it very, I think, powerful, right? We don't have to understand to have compassion for folks. And so while, right, sometimes we may not understand, compassion is just making space for people to live and be how they want to be. And that's how we can, start to shift that heteronormative perspective within us and within the world, and the influence that we all can really have. So folks don't feel like they have to hide, that they have to go away. So, I think our time is up. I might have gone a little bit over, but I hope this was helpful. And if there are any questions, I'm available. So thank you all so much. Take care, and thank you.
Hi, Elizabeth. Thank you so much for the wonderful presentation. It's truly educational and helpful to us. So there is one last question that that may be relevant to some of our participants, or to all the participants. What is the best way to approach or to start the conversation, or even ask the question on what is your pronoun, or how do we call you?
Yeah, just like I sort of introduced myself, right? Hi, my name is Elizabeth. My pronouns are they and them. What is your name? What are your pronouns? Yeah, just like that. Yeah.
Thank you. And we have a chat question here, question in the chat. Would you mind sharing your contact? Perhaps you can verbally say it, and then I will send a copy of the presentation too.
So you can find me through my practice name, Colibri Family and Healing Therapy, Inc. Or I can also add it in the chat here. This is my email as well. Therapy. We have a practice here in Long Beach, but we do virtual stuff as well. Yeah, that's where you'll be able to find me.
We have one comment. Thank you for sharing and educating me.
Oh, thank you. Again, when we can open our heart, when we can open our mind to just to allow for the possibility of things to be different, that's going to be at the core the more helpful, because anything else you can figure out, you can learn new skills, you can learn new information, that takes for us to be open, to be able to receive something. So thank you for your openness.
Yes, and one last question, Elizabeth, because this has been asked prior to the session today. If we have children or child who has questions about where they need to go or lean in terms of gender identity, what would be my best response? That was the question of a parent from our staff.
Right. So is that, was that a minor asking or a parent asking?
A parent asking.
A parent asking, okay.
A parent asking on how to best navigate the situation.
Okay.
With the child.
Right. Okay. I would sort of open it up with a parent and say, right, well, tell me your concerns. Right. Tell me your concerns and what is the help that you're looking for. Right. I think nowadays parents are feeling more comfortable and more accepting of their kids. It's just now, okay, like I love my child, I support my child. Now, how can I help them be okay? And so that's going to be like, okay, well, do you need mental health services? Do you need medical referrals? So it's asking what is the type of support that they need and the types of questions that they have, so that we can assess, right? We can evaluate how do we guide them.
Okay. Thank you so much, everyone, for your participation. And thank you so much, Elizabeth, for sharing with us a little bit of your time. I know you're super busy down in SoCal.
Yeah. It's I love it. It's something I love. So it's fulfilling. But yes, I definitely need a little break and bring another video so that I could probably share with the rest again in the future.
Yes, and thank you for this. According to one of our participants, I'm always working to make my patients more comfortable. I think this all helps me.
Of course, yes.
So everyone, I have posted the evaluation on the chat, so please feel free to complete it so we would know what sessions to offer. Our next session next week will be Conversations at Noon with Dr. Donna Ehlers. Thank you so much.
Thank you, everyone. Take care. Bye-bye.
Yeah, I normally close the session like after 10 minutes or 15 minutes because of the eval link.
Oh, okay.
Okay. Thank you. And looking forward to a copy of the presentation so we can send it to the participants.
Yes, I will send it your way. Yeah. All right.